what are the most common shoulder issues / injuries you end up seeing?
Yeah, the number one most common thing I would say is tendonitis. CrossFit for most people is something that they haven't done. A lot of people are, we're college athletes or high school athletes, and they're 30, they're 40, they maybe have a kid, and they're getting back into, feeling like they've got to lose the dad belly. And so they start lifting weights, and they start putting weights over their head, and they start doing more push-ups, and maybe even advancing to pull-ups, and maybe even advancing into further elite gymnastic type maneuvers, which, is another issue, but we have to be careful with that. But so number one is it's just volume, higher training than what they've been doing by, pushing around a shopping cart and carrying their 2-year-olds and 3-year-olds. So I think that's really the most common thing I see is just the new onset of new activity for something that people haven't seen a lot of in their shoulders.
Yeah, it definitely makes sense. I know this is a kind of a tough question, but in terms of which tissues are getting irritated, are you talking the rotator cuff? Are we talking
hands down biceps? Biceps tendonitis is, because I've seen enough of people with, this anterior, and I'll show you the anterior shoulder pain, and I've gotten MR arthrograms on a bunch of them because they continue to not improve as quickly as we wanted to, and their labrum's clean, their rotator cuff's clean, and there's no structural deficit, but they continue to have some residual biceps pain. And so I think that's, biceps tendonitis until proven otherwise. And eventually with more time and more activity modification and rest, it goes away, gets better. So I've been able to, see people from the beginning all the way through their biceps tendonitis. And that's really the number one most common thing I see.
Okay, that makes sense. So I'm going to switch gears a little bit on you. So it seems like the biceps tendon is what ends up being the most irritated for most folks. Yep. Usually some time off, some rest seems to really help with that. How about those more challenging cases where the pain is sticking around for longer you'd like to see? Maybe they do have some positive findings via MRI, and you're going down that route of surgery. What are the common surgeries you end up performing for these folks?
Yeah, so then if you're talking about structural issues, tears, things I see probably most commonly are slap tears and then partial rotator cuff tears. If, again, we're taking a pool of people this big, and we're bringing it down to the people that don't get better and the people that have failed conservative management. So the ones that I see that don't improve are mostly, I'd say, slap tears, partial rotator cuff tears, and maybe some anterior labral tears from, they may have had an event like a snatch gone bad, with a weight that was maybe probably too heavy for them, and they feel, that sudden shift, the subluxation. So.
Yeah, great. I was going to expand upon that, these acute versus chronic injuries. Let's go down that acute route just because you had mentioned it. So when someone has a traumatic injury in the gym and they end up going to someone like yourself and they do some imaging, my shoulder hurt myself doing X movement, and then we find out, yeah, you probably need a surgery. What movements are causing these problems? And then what are the surgeries that people end up getting?
Yeah, good question. Whenever anything tears, the question is, was it something sudden? Was it a weight that they pulled that was too heavy? A lot of times, they don't have a clear history of anything going bad or going wrong. Then you can talk about, volume, and maybe if somebody has been increasing their volume, and then you get into just like pitchers who have slap tears, that, volume, the amount of volume and maybe fatigue could come into play. So, being sure you have good coaches, good programming, keeping the overhead volume down, or, mixing it up, not having a month of, 100 kipping pull-ups a day. We obviously talk about kipping pull-ups. Is that really the issue? We talk about how to prevent people from having labral issues by keeping their kipping tight, not, getting into that big exaggerated kip. But then you get into, amount of weight, like, is somebody putting up too much weight? And, the body's simple. You have cells, and the cells attach. And if the cell force gets exceeded, it's going to rip. So, you know, being careful with PRs is really important. You know, you can't expect to make big PR jumps if your body's and your tendon, you know, your tendons aren't used to it.
Yeah, that is interesting. I want to run a few movements past you that I've seen problems occur during, and then I wanted to kind of get your experience, because I know you're an injury magnet. You have so many folks that come to see you for so many types of injuries in the gym, and it's really good to kind of get your thoughts on which movements might be causing the problems.
Sure.
I've certainly seen people snatching and lose that weight, maybe a little bit behind them, and they come forward with their head a little too much. Maybe the weight wobbles some, they catch it funky. And it seems like they'll have labral pathology, although some folks maybe tear a cuff or something from that perspective. Have you seen that? Is that what you tend to see from a snatch perspective, or?
So snatching, yeah, I call it the flying V, you know, where the arms are back here, you know, the flying V. I've seen some subluxations. Some people have dislocated. You know, so again, usually heavier weight than what they should be doing, going for a PR. So yeah, I've seen labral tears with that.
If you guys are liking what you're listening to right now and you want to continue with the rolling, I have another video for you. It's called When Do Rotator Cuff Repairs Fail? So unfortunately, a chunk of these rotator cuff repair surgeries will fail, right? And it's important as physical therapists to know when these are actually occurring so we can be a little bit more cautious during this time period. So I'll leave a link above my head and go ahead and learn a little bit more about when rotator cuff repairs fail after surgery.